So this is our final short talk on the nerves of the upper limb. The case is that of a 75-year-old female who presents to the emergency department after a fall. As you can see, she suffered a Colles fracture and she complains of tingling in the fingers. As usual, pause the video, see if you can figure out which nerve is affected. Think about the anatomy of that nerve and also the clinical features associated with a nerve injury. This is the median nerve. So the median nerve, it has a very broad origin. So it's supplied by fibers from nerve roots of C5 all the way down to T1, and because of this it actually receives branches from both the lateral and medial cords of the brachial plexus. It then runs, but actually throughout its course, this nerve runs fairly close to the brachial artery or one of its branches. So in the arm, it runs with the brachial artery in the medial aspect of the arm, right down the medial aspect of the arm and then into the antecubital fossa. It crosses the antecubital fossa, lies deep to the bicipital aponeurosis, and then emerges from it to run between the superficial and deep layers of the, well, actually the superficial and the intermediate layers of the forearm flexors. That is to say, between flexor digitorum superficialis and flexor digitorum profunda. Just proximal to the wrist, it emerges from between flexor carpi radialis and flexor digitorum superficialis, and then runs deep to the flexor retinaculum, so within the carpal tunnel, to supply the muscles of the thenar eminence and the muscles of the radial two lumbricals. So its motor function includes innervation of flexor carpi radialis, pronator quadratus and pronator teres, flexor digitorum profunda, flexor digitorum superficialis and palmaris longus. The medial side of flexor digitorum profunda is supplied by the ulnar nerve, so that muscle is supplied by two nerves. It also supplies the muscles of the thenar eminence, or the thenar muscles, which does not include adductor pollicis. So it supplies the other thenar muscles, flexor pollicis brevis, opponens pollicis. It also, as we said, supplies the lateral lumbricals. Its sensory functions includes the palmar skin of the hand, the thumb and index finger, and therefore the clinical features include, for nerve injury, would include weakness of thumb function, weakness of opposition and abduction, and also weakness of forearm pronation because of the effect on pronator quadratus and teres, according to the level of the injury. Of course, a wrist injury will not affect forearm pronation. The common injuries that lead to median nerve palsy include carpal tunnel injuries, for example Colles and lunate fractures, and elbow injuries such as supracondylar fractures. It is also a nerve that might be affected with compartment syndrome of the flexor compartment of the forearm. So that was the last nerve of the upper limb that we would look at. If you have any questions, you can bring them up in class. I hope that you found this series of lectures useful. This is just a reminder of the nerves that we covered. Again, thank you for listening.